Back to the third hour of today, we're going to turn our attention now to health. Not only is it the first day of November, but it's also the first day of Movember, a month-long movement where men grow out their mustaches, facial hair in support of men's health awareness.
It's true, you'll see it all over the place. According to the CDC, almost 15% of men in the U.S. over the age of 18 are in fair or poor health.
So we called on Dr. Cedrek McFadden. He's a board-certified colorectal and general surgeon. We called on him for everything that we need to take, or everything we need to know, I should say, to take steps toward a healthy future. Good to have you. First time in the studio, Dr. McFadden.
Yeah.
Thanks for being here.
So there's this survey from the Cleveland Clinic. I'm sure you're familiar with it. It found that 72% of men would apparently rather do household chores like cleaning or mowing the lawn than go to the doctor. So why do you think it's so important to shed a light in November on men's health specifically?
Well, the ultimate goal is to allow men to become active participants in their health care. And the challenge we find is that, unlike women, men are less likely to go to the doctor. Even if they fall off a ladder, a man is more likely to give some resistance to getting some help.
And walk it off.
They're walking off. Yep.
And the problem that creates is it creates a space where they don't get the preventive care that they need, that we know is so important to prevent diseases and to help them be treated more accurately.
So on that note, then, let's talk about screenings and medical care that you need, depending on your age and background. So let's start with people who are in their 20s and 30s. For men, where should they be, or what should they be doing?
So I like to think of the 20s as a period just if you get a new car. You're going to do all the right things to make sure that car is running well for the long life of that car. So doing the preventive thing, finding a doctor or medical team that you trust that will listen to you and that you can talk to, not just about heart disease and risk factors and immunizations, but about the detail that are sensitive topics, erectile dysfunction, sexually transmitted diseases, creating that team and that pattern of health that you want to continue throughout your life. Not smoking, minimal alcohol, exercising.
It's like forming a relationship.
Absolutely. You want to date, but really solidify that relationship before you get older.
Good.
And then what about doctors? You get a little bit older. We're talking. I know, Craig, you tragically lost your brother to colorectal cancer. As you get into your 40s, what do you need to be looking at?
So there are 3 big tests that you need to be getting in this age group. When you're 45, you do need to be screened for colorectal cancer. That can be with a colonoscopy. That can be with other blood tests or stool-based tests. Also, when you're 50, you need to have the finger in the bottom, and you need to have the blood test, the prostate-specific antigen, or the PSA, looking for prostate cancer. If you're 50, also, if you've been a smoker or you are smoking, you need to have a test for lung cancer. And if there's a family history, these tests may need to be done sooner, especially if you're African-American. The risk is higher. You need to have those tests done as well.
Going back to colorectal cancer, and I know that's your specialty, and full disclosure, you knew my brother fairly well. And for folks who are watching and listening, if they don't have a family history of colon cancer, at what age should they be getting that colonoscopy?
Well, for years it was 50, but for everyone now it's 45. We saw a number of younger patients that did not have any family history but were diagnosed with advanced stages of colorectal cancer. And so that scaled back. The United States Preventive Task Force changed those recommendations to 45.
When you look at folks who are 60 plus, obviously it's not a secret, had prostate cancer, and I know it really affects men, black men, more than white men. What should we be doing as far as our base is concerned for prostate cancer and other screenings to make sure that we're staying healthy?
So you're going to continue the same screening that you started earlier on, okay? And you'll continue that past 60, okay? Depending on that age group, we really shift more to the cognitive function, right? Making sure that we're staying sharp. Most of us think about retirement in this age group, but just because your body's ready to retire, your mind doesn't have to, right? So you want to stay sharp, you want to stay engaged with your social groups, interactions, hobbies, and your family's health and wellness.
Vaccines are pretty important, too.
Vaccines are important. We get the shingles at 50. We also begin pneumococcal at 65.
What about can we bring that full screen back one more time? I just saw something about abdominal aneurysms?
Yes.
How do you look for those?
So if you've had a history of smoking, you get an ultrasound in your 60s looking for dilation of this large artery in your body.
Or just stop smoking too.
Definitely stop smoking earlier than later.
Earlier than later.
That's great.
Dr. McFadden, thank you.
Thank you.
Good information this morning.
Welcome back to the third hour of today. We're going to turn our attention